Hello, everyone. My name is Lisa Holland, and I'm in the Communications Department at Families USA. Thank you for joining us for our media briefing, Voters to Congress and President Biden. It's time to go big on healthcare reform. You're going to hear from Frederick Isasi, Executive Director of Families USA, and Geoff Garin, President of Hart Research. Afterwards, we'll take questions. You can ask questions by posting them in the chat box or by using the raise hand feature and turning on your mic and camera. My colleague Adina Marks will call on each participant. So we'll get started now, and I'll turn it over to Frederick.
Hi, Lisa. Thank you so much. And thanks to everyone for joining for this discussion. We're really excited to be able to release some very important polling research that we've done with Geoff Garin, who's here to kind of walk us through it. And wanted to kind of give folks a sense of how this all came about. So about last summer, we became very interested in families to understand the way in which this really profound experience of COVID and the pandemic may be shaping the public's understanding and their political willingness to tackle health reform issues. And so we started by going into the field with Drew Weston, who's a real comms leading light, to understand what kind of messages were resonating most with the American public, given the shared experience of the pandemic. And what we found out was that across the political spectrum, people really believe in the idea that health is foundational and should be available to all Americans, all people in our country, as a way for them to self-actualize. And that research was all produced into a messaging guide that lays out the ways in which we can bring people together across political ideology in the era of divided government to really tackle the tough reforms needed in our healthcare system. Then, after the election cycle, after all the dust had settled, we worked with Geoff and his team, Corey and others at Hart Research, to really examine the question of post-election, where are the American people on this new Congress and President Biden thinking about significant healthcare reforms? And we went into the field to kind of ask that question. And the results are pretty powerful. And Geoff will walk through them, I think, very carefully after I'm finished with these opening remarks. But big picture, here's what we learned. We learned first and foremost that the affordability of healthcare for families across this country, be Republican, Democrats, urban, rural, it doesn't really matter. For almost all families in this country, the affordability of healthcare is a number one concern. And it's one of their most significant concerns that they bring to policymakers amongst a long list. So it is not just their top issue with healthcare, but it's really one of their top public policy issues. The second thing we learned was that there's a lot of hanging in Washington about whether or not reforms should go very far. Should they be completely disruptive? Should they just be kind of edging us towards a better system? And we asked the American people that question. And what we learned was that the majority of folks, really a large majority of folks, are most concerned that Congress and President Biden won't go far enough. They told us that they want real reforms that actually solve the problem, that make healthcare affordable. And amongst all the affordable issues, the one that really shown the most was prescription drug costs. That was one of their most important concerns. And so that was another really important takeaway. And then the last was, I think, a result that really kind of overwhelmed us, that the vast majority of folks polled, and these are all voters, either Democrat, Republican, or Independent, a really representative national sample. Their belief is that the current U.S. healthcare system works much more for the benefit of industry, of health insurers and pharmaceutical companies than it does for actually the American people and our health. There's a real concern and cynicism about the way in which industry has manipulated the current public policy framework, laws, regulations, to their end, and they aren't really serving the needs of families. And that certainly is backed up by a ton of research and data about our health outcomes, our costs, the ways in which health is not equally available to all in our country. So those were sort of the big top lines that we found in that research. We think it's particularly important that this is coming out right now. As the president has made very clear, and leadership in Congress, job one was to really develop a full-throated national response to the COVID pandemic. And that meant, creating a nationally coordinated, scientifically based run at protecting people from getting infected, helping them once they got infected, and of course, getting vaccine into the population as quickly as possible to protect us. That is absolutely, here we at Families have felt very strongly that was absolutely job one. We're really proud of the work we've done to support that. In addition, of course, was the recognition that the pandemic has been a terrible economic crisis for so many in our country. We've lost employer-sponsored coverage, lost their jobs, are in threat of eviction, housing insecurity, food insecurity, and that we finally have a national response to address the economic crisis that the pandemic has created. So we applaud the president and the Congress for taking that bold step. It's wildly popular. About almost 80% of Americans support it. So we're glad that that's happened. But now Congress turns its attention to what will be its next big push. And we've heard lots of things about an infrastructure bill, probably moving on reconciliation, a long list of priorities that are being considered. And we think that the results of this polling really underscore to both Congress and the president that they have to include real, meaningful affordability provisions in this legislation that's being considered. It needs to make sure, it needs to solve the problem. It can't be marginal, it can't be around the edges. It needs to solve the problem and make sure that healthcare really is affordable to all in our nation. So we wanted to release these results today as the work on the first package is now coming to a close, and we're working away on what this next package is going to look like, and really make sure that policymakers understood how important to both the American people and their political future it is for them to really tackle this problem. So with that, let me turn it back over to Lisa and keep the conversation going.
Thanks very much, Frederick. Appreciate those remarks. Excuse me. Now we're going to hear from Geoff. He's going to take us through the results. So take it away, Geoff.
Geoff, it sounds like you're muted.
There you go. Sorry about that. Thank you, Lisa and Frederick. We completed a national survey with a representative cross-section of voters who participated in the election. We interviewed a total of 1,600 voters nationwide. The sample is representative of what occurred in the 2020 election. So 51% of the voters in our sample report having voted for Joe Biden, 47% for Donald Trump. You can see that the partisan division is relatively even between Democrats and Republicans in the sample. So as you see, very positive and avid results around healthcare. That's not because we have a Democratic-leaning sample at all. This is very much of a balanced sample, and demographically, the respondents are reflective of the country as a whole. In terms of the data, we'll just run through really quickly. Let me just highlight the most important takeaways from this. First, what you'll see is that voters across the electorate and across party lines truly are looking for meaningful action this year on the topic of healthcare, specifically related to reducing the cost of healthcare. And this is not a partisan mandate. It is something that is important to Democrats, Independents, and Republicans. To the extent that there is a concern about that something untoward will happen, the concern is that Congress is not going to go far enough to address the problem of high healthcare costs and high prices, as opposed to making too many changes in the healthcare system. And that's specifically true, or even more true in the case of drug prices, as you'll see. So that when voters are focused on the issue of high drug prices, by a very large margin, they are more concerned that Congress will not do enough to address that problem, as opposed to that it will go too far in doing things that will undermine innovation in the pharmaceutical industry. Expanded coverage and equity in healthcare is an important focus, but really the driver in terms of what voters bring to the table on the issue of healthcare has to do with the cost of healthcare and the need to lower healthcare prices, and then in terms of speaking to the public and marshaling this public will, the strongest messages that we tested relate to excessive prices by the drug industry and the health insurance industry, and those industries taking advantage of their power and of their consumers. And there really is a call in these results to bring the country together around making sure that there is affordable health care for all Americans. In terms of the basic point of this being important to voters, we gave voters 5 different options here and asked to what extent should healthcare be a priority for Congress and the president this year. 75% of all voters picked one of the top 2 box responses, saying it ought to be one of the top priorities for Congress or a high priority. So 75% of 3 out of 4 voters are highly motivated around this issue. And then just 25% say it should be a medium priority, a low priority, or not a priority at all. So there's really a great deal of intensity around that. And again, the intensity is, cuts across party lines here. So if you look at the column under the blue header here, you can see that 91% of Democrats, 75% of independents, and 58% of Republican voters say that dealing with the healthcare system should be a top priority or a high priority. We also asked people about the magnitude of the changes that are needed. And a majority of voters tell us that they're not just looking for reform, but really big reform. And that's particularly true among Democratic voters and among independent voters who say that we need big reforms. Here's that table here. So 51% say big changes and reforms are needed in the healthcare system today. 38% say some changes and reforms are needed, and 11% say only small changes or no changes at all are needed in the healthcare system today. So half of all Americans are looking for something very big and substantial. That's particularly true with regard to prescription drug costs. Here we're asking voters within the various aspects of healthcare, how important is it for the president and Congress to take action on this year? You can see that 72% of voters say it is not just important, but very important for the president and Congress to take action to lower prescription drug costs and stop excessive increases in prescription drug prices. And 92% say it's either very important or fairly important. So there's a kind of a universality about this. And then in terms of lowering healthcare costs more generally, 68% say that that is a very important goal for the president, ought to be a very important goal for the president and the Congress this year. And as Frederick mentioned, there is also a lot of energy about making sure that that everyone has access to comprehensive health coverage. The issue of addressing disparities in healthcare, racial disparities in healthcare, is important to voters in generally, but is particularly important to voters of color and African American voters, specifically 86% of whom say it's very important for the president and Congress to address this problem of racial disparities in healthcare. On the question of these various health priorities, you can see that lowering the price of prescription drugs and stopping excessive drug price increases is important to voters across parties. So 81% of Democrats say not just that it's important, that it's very important. And so do 65% of independent voters and 64% of Republican voters. Among Republicans, if you look at the red dots here, lowering the cost of healthcare in general is also very important to a majority of them. But lowering prescription drug prices really stands out as a topic of very substantial importance to Republican voters. So this is not just a kind of a Democratic project here. This is a project of the American people, regardless of their party affiliation. We asked people what is their bigger concern about the way Congress will deal with the issue of healthcare, that it will go too far in making changes that increase government spending and give government too much control over the way our healthcare system works, which is a critique that is often heard about healthcare legislation, or that it's not going to go far enough in making needed changes to lower costs and ensure all Americans have health insurance. And by a margin of 51 to 40, voters are more concerned that that Congress won't go far enough, than that it will go too far in making these changes. And that is the majority or plurality response of all groups of voters, with the exception of conservative Republican voters. But across the rest of the electorate, more voters are concerned about government not going far enough than going too far in addressing these very important healthcare challenges. We asked a similar question with specific regard to the issue of drug costs. And here the result is even more lopsided. We asked people whether they are more concerned that government will go too far in regulating. So, we took the word regulating drug costs, reduce, and in a way that would reduce companies' ability to invest in research development of new life-saving drugs. So taking on this whole topic of innovation, versus that the Congress won't go far enough to lower prescription drug costs and allow drug companies to continue charging excessive amounts in a way that makes medicines too expensive for many, which is something that people think is now occurring. And here, given these two concerns, it is very clear that overwhelmingly the greater concern of voters by a margin of greater than 3 to 1, or just about 3 to 1, is that Congress won't go far enough to lower prescription drug costs. So this idea that government is going to get in the price control business, or that it's going to undermine innovation by eliminating the money that companies use to do R&D for new life-saving medicines, simply does not stand up right now to the concern that voters have about high drug costs and the pressing need they see for Congress to address that. And here, whereas conservative Republicans came down on the other side on the broader question here, when we're talking specifically about prescription drug costs, by 55 to 36, people are conservative Republicans are saying the bigger fear here is not that government's going to regulate too much and interfere with the kind of R&D of the companies, but it's not that Congress won't do enough to address the problem of high drug costs. Part of the reason that the results are coming out the way they are is that people have this, I think, fundamental perception of what's happening in the healthcare system today, that it's not designed to benefit them, but designed rather and being run rather for the benefit of the insurance and drug industry. So this is a very simple question. We said, who does the healthcare system work for today? And you can see 82% say the healthcare system works for the benefit of the insurance and drug industries. Only 18% say it works for the benefit of the average person. That is, I think, a very damning and finding overall. And again, it's a finding that cuts across party lines. So this critique of system that kind of is rigged for the benefit of insurance and drug companies is not just a Democratic perception, but 7 out of 9 Republicans share in that as well. So, I think sorry, I thought we had one other slide that we don't. So, the takeaway here is, very clear, and the call to action from the voters to the president and to the Congress is very clear, is that healthcare is a dominant topic for them. It's a very important concern, and that the demand is really for the president and Congress to do things that will really address the challenge of high healthcare costs, and specifically high drug prices. And the fear is that, not that it's going to do too much and upset the apple cart too much, but that it will do too little and not really solve the problem that is of such great concern to people. So with that, Lisa, let me turn it back to you, and happy to answer any questions.
Thank you, Geoff. And looks like it was my internet that went out, and that's why you froze on my end, because suddenly I was gone from the screen and came back. So apologies for that. Really appreciate you taking us through those results. Now we're going to open it up for questions. Before I want to do that, I want to just flag that we've dropped the one-pager on the results in chat. We'll also send that around via email, but just wanted to make sure our participants can take a look at that. And now we'll open it up for questions. So again, you can ask your questions by posting in the chat box or by using the raise hand feature and turning on your mic and camera. And Dina Marks, my colleague, will call on each participant. So take it away, ask us any questions you have. No questions? Okay, I'm gonna ask one just for Frederick or Geoff, because you guys have been in healthcare policy for a while. So was there anything surprising? Was it kind of as expected? Was there anything that stood out? Those are several questions, but just kind of curious, what you were like, kind of like what you were thinking with this, like, oh, that was interesting, or yeah, I expected that, or,
Well, one thing, Lisa, that I would point to is that, we conducted this after the development of the COVID vaccine. And I think it was an open question about how people would be thinking about the pharmaceutical industry in light of that. And there may be some kind of general halo effect for the work of the pharmaceutical industry in developing the vaccine, but that has had zero impact on the way the public views the issue of drug prices, for example. And even in a world where a vaccine was developed as quickly as it was, we still have 82% of voters who are saying we have a healthcare system today that is run for the benefit of drug companies and insurance companies, and not for the benefit of the average American. So I think that was kind of one of the very important empirical questions here. So, while there's a belief that the drug companies do good work and did good work in this case, that it does not mitigate the demand at all that Congress take action on drug prices or reduce the perception that the drug companies charge unreasonable amounts for medicines today.
Lisa, I was just to add to that, there's really, I think, terrific points Geoff just made. I think one of the things that really struck me was that, as Geoff was saying, we tested this question about, really picking up the negative messages that pharma tries to use in defending their undefendable practices of government intervention and government regulation, things like that. And what we found was that the American people are not fooled. And in a bipartisan way, the idea of the government getting in and stopping the abuses through regulation was wildly popular. That this is an example of where the American people, Republican or Democrat, really do want the government to step in. And the thing about that, to me, that's so inspiring is that, this was I think it was a couple years ago when I testified in Congress on this. It's important to remind Congress that the abuses of the pharmaceutical industry on prices, for example, and there's other actors out there like private hospitals, manufacturers of some medical devices, they are using a government granted monopoly or quasi-monopoly to actually engage in this really abusive pricing. So fundamentally, Congress created this problem. And the only people, we do a lot of work on the state level trying to help states address these problems, but there's a limit to what they can do. The only folks who can really solve this problem are the very people who created it, which is Congress. And they need to change the laws to make sure that these classic economic, what people refer to as market failures, where we don't have a real market for things like pharmaceutical prices, drugs, or a lot of healthcare services. We don't know what we're buying. We don't know if it's high quality. We don't know if the price is worth it. We don't know if one thing is better. Is the aspirin better, or is the $1,000 a pill medication better? We don't know. We don't know those things because industries work very hard to make sure we don't. And the American people have woken up to this reality, and they want the government in there fighting hard to address these abusive practices that Congress created the authority that the companies are using to engage in these abusive practices. So that was really inspiring to me.
Thank you. Appreciate you all sharing those thoughts. I got a couple of questions in chat, so I'm going to read our first one. It's from Alex Ruoff from Bloomberg Government. Do you have any sense of public sentiment to dealing with the price of COVID vaccines specifically? Would these results change if questions around drug pricing mention the vaccines?
Well, what we do know, Alex, is that that we asked voters, today or very recently, after the vaccine had been made available at low or no cost to the patient. Do they think that drug companies charge a reasonable or unreasonable amount for medicines? And we are still getting super large majorities of voters saying that drug companies charge, and even in the wake of, if not in the light of, the vaccine experience, there's been no, and this is something we've been tracking over time, there has been no diminution of in the percentage of Americans who believe that the pharmaceutical companies charge an unreasonable amount for medicines today. So I don't think we have a question that said, they did the vaccine. Do you think that, do they charge too much? But people, we asked it in the context of people's, own experience with that. And Frederick, do you want to make the point we were talking about earlier today about about the vaccine?
Yeah, that's exactly where I went, Geoff, which was Great question. The thing to remember is that the vaccines are a perfect example where the government actually got in, worked directly with the leadership of the pharmaceutical companies, and negotiated a price. It's a perfect example of how the system could work if we get these changes in public policy. And as you know, what it's resulted is in what could potentially be a surplus of vaccine for the American people. So I think our first test run on this has shown that it works and that it can really serve the American public.
Great, thank you both. And then I'll read our second question. This is from Maya Goldman. She's from Inside Health Policy. Do you have any information on how this data compares to voters' healthcare reform priorities prior to the pandemic? Good question.
It is a good question. The concern about price, well, I would make 3 points. First is that post-pandemic, job number one is getting the COVID in our rearview mirror. Job number two is fixing the economy. And to some extent, this addressing healthcare is part of that. But to the extent that, the next priority, and I think there are really three big priorities for Americans, is getting the cost of healthcare under control and reducing the cost of healthcare. So that in a kind of where we are today, in a hierarchy of priorities, healthcare is very much part of the three big mandates for the voters. I was sharing data with Frederick earlier today from a poll we did for Center for American Progress, and where we asked people, what does Build Back Better mean to you? Like how will you know in a year from now whether we're really building back better? And in addition to knowing, and kind of really at an equal level with knowing that we've created economic growth that is that benefits the middle class and working families, the second kind of metric for people is, are healthcare prices lower? So that's one thing. What I would, the concern about the cost of healthcare has been durable. It's not much higher, but it's no lower than it was before. This is a concern that preceded the pandemic, and the question of whether, for example, drug prices are too high has not been diminished by that at all. The other kind of real, I think, impact of the pandemic is the value of healthcare has got, just people having healthcare has become even more salient to voters because of the pandemic. And so, the concern about people losing coverage in the middle of the pandemic, people see that as very consequential. And when we ask about the healthcare provisions in the American Rescue Plan, for example, to address both cost of insurance premiums and the ability of people who are uninsured or lost their coverage to get coverage, those provisions, people don't know about those provisions, but when people hear about those provisions, they are extremely popular. And so the saliency around people's access to healthcare has grown because of the pandemic. The one other thing that I think has happened as a result of the pandemic is the pandemic has exposed a lot of the weaknesses in our system generally, but it's particularly exposed the disparities in our system, and I think made people much more aware of and sensitive to the degree to which there are disparities in the healthcare system, and there are large numbers of Americans who are underserved in the healthcare system.
Beautifully said, Geoff. The only thing I would add to that is, and this is actually coming from the messaging work that we did with Dr. Weston back in August. and so it presents interesting hypotheses that need to be tested. So I'd say these are more kind of directional indications that we got through that research, which was one, there seems to be a greater understanding of the fact that health is not just simply being able to go see a doctor, that the social determinants of health are important and really impact people's lives. And so for things like, clean air and asthma prevention programs and obesity prevention programs and things like that can have real impact on the ability of people to live a healthy life. That would be the first thing. The second thing, much to what I think what Geoff just talked about, was a renewed understanding of the interconnectedness of health and economic vitality. And not just on the individual level, but as a nation, that the two things are critically important, that without health, we won't have economic vitality, and that in fact, things like a pandemic or widespread threats to health can actually really damage our ability to have economic vitality. And the last thing is really interesting. I think Geoff hit really well this sort of awakening or renewed awakening or deeper awakening of the disparities in our society, particularly around the ability of people to live a healthy life, if they're people of color, if they're people living in rural America. And kind of adjacent to that was also this kind of awakening to who the frontline workers have been and who the people who have really kept the country going during the pandemic are, and a kind of acknowledgement that these folks who really, and it's not just the doctors in the clinics, but also the folks cleaning the hospitals and the nurses and the folks collecting our garbage and delivering our packages, that those people played an incredibly important, the people picking our food and transporting our food played a really important role in keeping our economy going and our country open. And that we think has real impact for the ability to protect coverage for all individuals in our country, regardless of race or ethnicity or immigration status, those sorts of things.
Great. Thank you both for those comments. And thank you, Alex and Maya, for the questions. I think this was an excellent discussion and excellent presentation. We're a little bit over time. So just going to wrap up here. As I said, we're going to be sending around an email with all the great resources. If you have any questions after this, feel free to email me, L Holland, that's LHOLLAND @Families USA. And thanks again for joining us. Goodbye, everyone.